I think before you get to this stage of numbers, where is it starting from? Is also another issue.
Yeah, so I just quickly to respond to that. So I only put this here, not as an exhaustive list of things we want to learn. So beyond this, there will be more learning, communication, policy, formulation, policy analysis. Beyond this is just basic to start the process, and then we take it to another level. And that also can, of course, change the level. I mean, the clientele. So here we are more or less talking about the technical people, but then at some level we also need to have trainings for policymakers.
Additional area is qualitative data and how to manage it. Then also, since you already have the description and kind of some idea on what the content would be, it would also be helpful to know, to have something on the duration for each of these modules, maybe 45 days. It would guide participation as well. Then also in the implementation, I would think, rather than targeting to have a very big group, would rather have like maybe run 2 courses twice to give people an opportunity. If there are key people who have maybe something major event, they could attend the second phase of each.
Actually, I liked your comment on the number of days because I think I had it in plan, but I felt I shouldn't ask it here. But I thought, that's a question that I also want to ask, like how long do you think such a training should take? I know it depends on how quick people can learn and the type of people you have. But I thought that if we did this, for instance, for 3 days, that would be fine. Whether it should be residential, maybe much better if it's residential somewhere in a deeper place than the way it is in some of the cases that we have. But that's all discussions that we can have within the team, and we make decisions on how we can do it better. So I want to thank you so much for listening and for your comments and your contributions. Yeah, we are NIPN and we are here, and we want to have as much support from your side, but we also try to do as much as possible to be demand-driven. Whatever you demand for, if you say, well, all this is not what we need, actually we need qualitative assessments before we can do the quantitative, and then we can change. So somehow we should bring NIPN to be real country-owned. This morning we had a discussion on what should we actually be doing. Is it going by the global framework or by what our constituents are asking for? And for me, I prefer the other one, but I also prefer to do it in a sustainable manner, that people that we have today can also move on to do these things in their own right, in their own institutions, and then they can move the nutrition agenda forward. It's actually depressing when you're talking about nutrition and people don't even know what it means, where it comes from, and where it is going. And we have more things, I think, to do.
Thank you so much, Nasul, for this presentation. I think you have now seen how far we have come and where we are going. And I think this is all about combining the efforts, working with you, and also serving what you want than what NIPN wants. A group on, we had health, gender, they are here. Gender, trade, education, agriculture, and health. So what are we going to do in those groups? We are going to review what we did yesterday in view of the feedback we got, particularly on the policy questions. Yesterday we got feedback through the discussions, and I hope you are all listening. And in the morning I gave some few slide presentations on how the NIPN questions should look like and what they shouldn't be. So we'd want you to go back and look at those policy questions you had generated yesterday and be able to refine them to review and refine those policy questions as per the feedback and the discussions of this morning. That's task 1. Then task 2, once you have agreed on those questions, maximum 5 questions per group. So we expect 25 questions at the end of the day. But for each question, try to identify the possible data sources that can help answer those policy questions. You see, when Nasulu was presenting, was saying we had these indicators and we are trying to identify where the data could be found, and we saw that spreadsheet. Here we are going to make another small spreadsheet based on the policy questions that you'd have generated. There was, if it's Ministry of Trade, you have a question about fortification and whatever, you could guide us. Possibly this data can be found in Bureau of Statistics. We have some kind of data source mapping that could help us as we try to answer the policy questions that you came up with. How are you going to organize this? Very simple. You'd have a column of the policy questions, and then you'd have the other side, the possible sources. You can do a simple matrix on the flip chart, and then we'll take it from there.
Maybe awareness of the content, because if I know that they are going to
I think that was fundamental for this question.
Because we know that this man here is an expert.
Then we have what goes I just want to I think there's something more we have to add on to the question. Come on,
Starting, scroll down.
Primary, lower primary, middle primary.
Yeah, because first of all, it was piloted. Some districts didn't have SAGE, others did.
That was one of the challenges. But one of the questions is we want to know what the trends of breastfeeding practices are between 2001 and 2016, or I mean 2001, 2016, that a period of about 15 years of the demographic health survey that we have. And by this, we're looking at things like how does it vary by region, by income, by education level of mothers, by gender of babies, whether boys are breastfed longer than girls, etc. And we think UDHS and UNPS can probably give us this information. And the same data sets would probably help us answer what the trends of complementary feeding practices are between the same period. We also want to know what the association of iron folic acid supplementation among women of reproductive age is with anemia, whether there's any impact or no. I mean, whether there's any relationship that can be established that is significant or not. And we think UNPS can do that. And then we also want to know what's still the role of IFA supplementation in mitigating undernutrition among school-going children within that age group. One of the other questions, the last question we were thinking about, is we wanted to see whether there's any trends in import of breast milk substitutes over a period of, say, 10, 15 years. And we can triangulate and relate any of that data with childhood obesity or any other nutrition outcomes that can be related. And we think URA could have some information on imports. And also looking at still the substitute, would want to know whether, because we know UNBS does quality assessments, would like to know whether these breastfeeding, these breast milk substitutes have been assessed continuously for quality and what the quality is that is being taken in. Because this, we think, would directly or indirectly translate into consumption of the substitutes versus exclusive breastfeeding. Thank you.
Maybe just the second last one, the role of IFA supplementation in mitigating undernutrition amongst school-going children, 5 to 18. Data source, I think there's a data gap. Right? Data source UNPS is not possible.
Okay.
Because it seems like you're saying that the children are given IFA. I don't know, maybe we need to phrase it in a different way.
Thank you. I think they have done excellent discussion, and they have come up with very nice policy questions here. The first two questions are perfect for me, looking at the trends of breastfeeding practices, complementary feeding practices, and they have even defined the timeline, and even the data is fine. For the third question, that's an interesting question, what is the association of IFA supplementation among women of reproductive age group with anemia? But yesterday I missed to talk about one study which are in pipeline. Again, supporting to MOH, but largely true is right now UBOS has collected data for UNPS. And as part of UNPS, they have also collected data for micronutrient related data, those biospecimen, the samples that have been collected. We are just now sending it to the lab for analysis, and once that will come, then the plan is to look at the data to see the etiology of anemia. Etiology is what are the causes of anemia in this country, what causes anemia in this country. So it will go beyond IFA supplementation, but then IFA supplementation would also be one, the explanatory factors in that analysis. So that is something we are in the pipeline, but unless and until we have data, we can't do that. So we'll have to wait till next year for that. The fourth question, she has already raised the question, and I have been raising in that group because for 5 to 18 years, I see that's a data gap. The last question, I would suggest that would be more appropriate to put under Ministry of Trade rather than Ministry of Health, because we are talking about import of BMS. I know it has an implication with Ministry of Health, but it would be interesting, good to have a collaboration between Ministry of Health and Ministry of Trade to do that research, because BMS related technical issues can be dealt by Ministry of Health, but the import related data, I think it would be good to have from the trade sector.
Okay, thank you so much for that input.
For the last question, I indeed agree, trade and MOH. However, besides just the importation, I think the consumption would be, the consumption of those substitutes could be a good proxy of whether the uptake of this is actually high or not, because it's not enough to say, oh, this much is coming in. How about consumption? What are the obstacles? Is it so expensive? Is it, you need to ask questions around that, because the substitutes may be good in themselves, but are people actually consuming them is the biggest question for me.
Question is 3. When we talk of women of reproductive age with anemia, reproductive age is 13 to 59. 15, no, I beg your pardon, 15 to 59, 49, 49, 15 to 49. We know that the greatest burden, the greatest problem with infant mortality and the overall results is because of the adolescent girls who are in schools who fall. I would imagine that that should also include some data from education, because the adolescent girls are actually in the women of reproductive age, a big percentage, who actually worsen the indices of childbirth-related issues are in schools. I think it should be. Then this other one, when we are talking about the role of iron folic acid supplementation in mitigating undernutrition. Now, the undernutrition there is so big. I think we need to qualify it. Do we want, since iron and folic acid is really addressing the issues of anemia, we specifically mention anemia. And then school-going children are usually primary. And yet, we are going, with that age group, you are even taking secondary. We just say children in school or something like that. Thank you.
This is very important, point always discussed. But in any country, Suzanne, we don't have data for adolescent age group, which is 10 to 19. The DHS collect only 15 to 19. And that is already part of that 15 to 49. So always the adolescent group, which is from 10 to 14, are missed in this analysis. Now, what we do is, we can do the analysis for that IFA supplementation looking at only the 15 to 19 age group, but then you have to make some kind of assumption that is a proxy also for 10 to 14, because we don't have the data. And I don't know if we do have. And if we do have the data, then it's fine, we can do it. But generally, that's the limitation in any country, because generally the data for 10 to 14 is not collected as part of national survey. Yeah.
Okay, thank you so much. Let's go to agriculture.
We are asking ourselves, that does consumption of biofortified foods in schools improve on children's nutritional status? And this is coming from a point, the context that currently there is a project that is under MAIF that is being piloted in about 1,400 schools. 1.5, yes. And that is why when you come to the data sources, we are talking about project monitoring reports and then also project evaluation reports. We can possibly get data from there to answer that question. Then secondly, we would like to find out how can awareness on biofortified foods or seeds in Uganda influence on their consumption. So we are trying to look at awareness vis-a-vis consumption. And we feel this data can be found with NARO and also MAIF. Thirdly, what different locally available recipes exist for feeding children above 6 months? What different locally available recipes exist for feeding children above 6 months? We feel that the data that can help us to answer that question could be found with the UN agencies such as UNICEF, WFP. They have some of this information, but also School of Food Technology and Nutrition, yes, bioengineering in Makerere. They also conduct a number of research, so they should be having some of these this data. Likewise, Chambogo University. That is what we managed to come up with. We restricted ourselves to biofortification, but ideally a number of questions could be generated just from within agriculture. Thank you so much. Any questions?
Okay, question.
Thank you so much, Maif. I have questions or concerns with question 1 and question 2. The Uganda Multisectoral Food and Nutrition Security's objective is to increase consumption of those biofortified foods, if we can call them that, at the community actually, but through schools. So getting the consumption pattern, limiting it to schools, I was wondering whether it would